Pyxis Partners is a public affairs and social impact firm that advances health equity, access, and affordability. My staff here at Pyxis was chosen on purpose. It was purposeful. If we were going to try to do the work that we are doing at the NIH in terms of diversity, equity, and inclusion in clinical research, I needed a team that looked like the people we were recruiting for these clinical trials. And that's what America looks like. I think this firm looks exactly like what America looks like. It's not a traditional staff in any way, shape, or form in terms of how consulting professional services firms work in Washington. The most impactful thing we do, we actually are making a difference. We're moving the dial. We had tremendous successes this year in the Medicaid space for our client ACAP, which all led to better coverage for the poorest of the poor in this country. We had victories over the course of years in making alternates to opioids available to people with addiction. Probably our greatest victory was in the work we've done in women's reproductive health with the Emma Project, and being able to change what's called the REMS. It's kind of what comes on the label of any bottle of drugs you get, saying how you can take them, are they dangerous, what are the side effects, and a guy could just get a prescription. A woman had to go into the doctor, take the pill in front of the doctor, and then come back for the second. Anyway, we changed all that. The timing couldn't have been better because the COVID pandemic hit, and it was such an alternative for women that couldn't get to medical facilities. So this was a tremendous way to give women a choice. On the other side of the firm is the work we're doing with the National Institutes of Health, with the Office of Science Policy at the NIH, about diversity in clinical research. And because my team is so authentic, and because of the community partners and provider partners that we've developed across the nation, with the incredible generosity of the National Institutes of Health allowing us to fund them to support the All of Us work, we figured it out, how to make people trust science. People who traditionally have not trusted science. There's such a history of abuse for people of color in science and medical research. I think by working with organizations like the Divine Nine, which are the sororities and fraternities that tend to be most prominent on HBCU campuses, but they're the people listen to that are in their fraternities, right? You're not going to listen to a scientist who comes in and says, take my drug. You're going to listen to someone in your community that you trust and know. Nobody's as good at it as we are. I think what makes us the most unique is the combination of having really, really smart people that came with incredible credentials from HHS, from Congress, people that were responsible for passing the Affordable Care Act, people that worked for secretaries of Health and Human Services, so they have this deep knowledge of the process. And you couple that with community, that's where the magic happens. Because you have to have an understanding of the smart stuff to be able to advise the community side. And so I think that's just part of the secret sauce. If I was a client considering a professional services firm and I actually wanted to get what I've set out to do done, I'd come to us. You know, on one side of the practice, which is diversifying clinical research, the FDA and now Congress in legislation has said, if you're going to put a new drug on the market and you're going to do clinical trials, you have to present a plan on how you're going to diversify these clinical trials. We know how to advise companies, and it doesn't even have to just be a pharmaceutical company with a new drug. It could be anything. It could be a hospital. It could be a chain of drugstores. It could be anything. But how do you authentically reach diverse populations? We have the answer. My team of accomplished leaders have a proven track record of success and delivering results for those we serve.